about replacement of their teeth. Grandma, grandpa, we want to replace your teeth. The person automatically thinks you are God. Oh, my teeth has fallen. This doctor has the magic power to replace my teeth, to make my teeth to come back. Okay, because they don't understand better. So that's the concept that they have from the language you have used to explain to them, because you don't want to speak to them with a lot of jargons in your communication. Okay, so it's important to understand for your patient, your client, to understand the conversation and give you informed consent, so that you know that this is what, so that they are sure that this is what they are doing. And this is about denture. Think about doing something more complex for a person that did not understand what you're doing for them. Do you get the point now? If you're doing a procedure for a person, if you're carrying out a procedure for a person who does not understand the details of the procedure that you are giving, perhaps they lack the capacity to understand it because of age, because of literacy level, you have to make sure that there is an accompanying person who has the capacity to understand and give consent on their behalf, or at least to explain to them however they will understand it. You need a clear consent. The problem we have in those of us from developing countries is that we don't get a lot of litigation. People don't take us to court quite a lot. If people take you to court quite every time, or if you have seen them dragging your colleagues to court, you will become more conscious of the treatment that you are giving to people. You make sure they understand, if you are going to extract this tooth, make sure that they understand it is extraction, that you are going to pull the teeth or the tooth out of their mouth. And here in the UK and in the developed part of the world, you will sign to say, I understand this treatment, that I agree. Okay, so that should there be a problem, should that person take you to court, you can actually defend yourself using the consent that the person has signed for you. Okay? Anyone else? Does anyone else want to share with us any misconceptions? Yes, Messi? Yes. Yes, I can hear. Yeah, but you can see from our conversation, we've looked at the history of denture production, that there was actually a time when people would request for the teeth of a dead person to be put in their own mouth. So now, yeah, go. Ah, yeah. Okay, do we have any questions? I think we have done justice to the time. Yeah, does anyone have any final questions before we finish? I'm becoming a bit sweaty. Does anyone have any final questions? Okay, in the absence of any final questions, I think this will be the point where we'll defer our sessions to next Friday morning. What I'm going to do is to tidy up the presentation and release for you the presentation for yesterday and the presentation for today. Okay, so I'll release those for you, and then we'll make plans for tomorrow. Now I want to give you some things, some take-home videos to watch. Okay, are you happy to watch a video? Okay, so I'm going to put this video in the chat, and make sure you open it now before we close the meeting. If not, you'll probably lose it. Where is the chart? Yes. Whether there are limitations. What was your question? Serious limitations. Of course, we've talked about those. There are limitations to everything that we are doing. So, in terms of the computer-aided design, computer-aided manufacturing, we've talked about the possibility of equipment failures. You could have a glitch in the system. You could have a poorly designed maybe job that is sent for production. Okay, so if the job is not properly designed and you send it, the milling system is going to reproduce for you an improperly designed work, and it will all be failed. So we say that it improves accuracy, it improves precision, but you need to have the techniques to use it. Do you understand? So, of course, there are disadvantages and limitations to it. And if you go back, if you revisit where we talked about core technologies in digital dentistry, under core technologies in digital dentistry, we looked at each technology. We looked at the advantages and disadvantages for each of the technologies. Okay, so please go back and look at those slides. We talked about each one of them. Intraoral scanners, we talked about the advantages and the disadvantages. The CAD/CAM system, we've talked about the advantages and their specific disadvantages. So if you look at those presentations again, you should be able to see that. But if you watch this video is a video of the 3D printing process. You can see what they are doing and try to figure out where could something go wrong in this workflow. Okay, so we'll continue with this conversation in our next class. Have you seen the videos? Have you opened the videos? Yeah, make sure you open the video before you close the meeting. If not, you will not be able to, you may not be able to come back to open it. Okay, everyone, I think that's the end of our session today. Is there any other question that we need to address? No, I put it on this chart here. Do you know where the chart is? Amarachi says, please, sir, I'm not seeing the chart. Under what Amarachi said, you will see mine. Yes, sir. Ibazo, I've seen it. Okay, so you don't know where the chart is. Can those of you that are using your phones, yeah, those of you using your phones, are you able to copy that link and put it in the WhatsApp? Okay, can someone copy that link and paste and put it in the WhatsApp? Okay, thank you. Okay, thank you, everyone. We shall continue on Friday. Okay, bye bye.